resilient, and hopeful about the future.
I believe that self-care is one of the single most important things that you can do for yourself. I'm teaching my children not only to love themselves and to embrace themselves, but also to take time out to find the things that make them happy, make them love, and to make them feel free every single day.
Today and every day, the Black Women's Health Imperative celebrates our diversity, our beauty, our magic, our confidence, our joy, our love of life, our love for family, and our love for each other. May we all be Black and well for generations to come.
Good afternoon. I'm Linda Goler Blount, President and CEO of the Black Women's Health Imperative, and welcome back to Black and Well TV. In 2014, a collective of sister organizations came together and formed the National Black Women's Reproductive Justice Agenda, known as In Our Own Voice. It's led by Marcella Howell. BWHI is a national partner in Our Own Voice. The goal was to amplify Black women's voices and to work together on issues regarding our sexual health and reproductive justice, taking this from conversation to movement to action and making the needs of Black women a priority and strategic focus in policy and in the practice of medicine and healthcare. As we look back, I'm wondering, did coming together prepare us for what we're facing today, and how will it prepare us to face the future? I have an amazing panel today to tackle these questions, so let's get started. If you have any questions, please use the Ask a Question function located at the bottom of the screen or the chat function to the right of the screen, and send us any questions you might have. We'll try to get to as many as we can on air, and we certainly will answer them off air. So let's get started with our first guests. I have two members of In Our Own Voice, Dazon Dixon Diallo, founder and president of Sister Love, the first women's HIV, sexual health, and reproductive justice organization in the southeastern US. And we have Marsha Jones, co-founder and executive director of the Afiya Center, located in Dallas, Texas. Hey ladies, how are you doing? Hey Dazon, how are you doing?
Good. Hi, how are you? I was like, oh, Marsha moved to Atlanta right quick.
Right. Marsha, how are you doing? Okay, so I think Marsha's working on her sound.
Okay, am I good? Am I here?
You are wonderful. Okay. Thank you. So let's get started, because we could spend 2 hours on these issues. So Dazon, Kimberly Crenshaw coined the phrase intersectionality 30 years ago.
Yeah.
The term reproductive justice came a few years later, the term. Right now, during this very justifiable protest, I look at Breonna Taylor's murder and so many others, obviously George Floyd. And I think if ever people needed to understand intersectionality, it's right now. So would you talk a little bit about the demand for human rights and social change for the reproductive justice movement in that context?
Sure, and thank you so much for the invitation to join Black and Well TV this evening. There are so many fabulous ways to spend a Friday evening or Friday afternoon with Zoom, and this is one of the best ways to do it. So welcome to everybody for joining us. First and foremost, I think with total respect to the power, the strength, the resoluteness of who we are as Black women requires folks to see us in all of the intersecting oppressions that we stand up against every day, or not, because we don't always get to stand up. And so right now, and Linda, I think you probably sent out an Instagram message, I think earlier last week, that said everything. It had the picture of a Black young woman with her belly full at about 7.5, 8 months,
Yeah.
with a sign that says, "I've carried," we carry them for 9 months. We go through labor for 9 hours.
Yeah.
Some mamas would say a lot more. And then you sit on their neck for 9 minutes. And
Yeah.
that's intersectionality. That is, because I'm Black, because I'm female, because I don't have the same power as a cop, whether it's because of where I live or how much money I make or how much education I have or the way I wear my hair or how I choose to show up in the world, that my life has this much value in the context of how much power you have over it. And so there's a need to understand, which is what I love about how we've been able to bridge the reproductive justice movement with the Black Lives Matter and the movement for Black lives, is because the interlocking, as we learned at Spelman College, the intersecting, interlocking, overlapping, interconnected oppressions require all of the same approaches: interconnected, interlocking, intersecting, and in some ways they have to be interdependent of each other in the way we respond to the need. So it's not just enough to end police violence and brutality and the policies that drive it. That's why you also see people starting to push for reparations, starting to push for pay equity, continuing to look at universal health care in this current pandemic/protest moment. That all of these pieces are coming to education for our children. I'll give you another example. One of my staffers had never considered homeschooling, didn't appreciate homeschooling. And unlike a lot of parents who cannot wait for the schools to open back up, it has completely shifted her mind over the type of education that her gifted child, who was going into gifted programs in high school, who's now being told that we're going to remediate everybody. And she's like, not my child. So even having that choice, and as a Black woman with a job, because, we take care of that, means that she gets the intersectionality of her power as a mother, as a Black woman, to teach her Black daughter how she wants to, including comprehensive sexual health education.
And one might guess she could give her daughter a much better, much more comprehensive education than her daughter was going to get being taught to a state mandated exam. But
yeah, the other part of that intersectionality, Linda, is that her daughter wants to go back to school. She's just getting ready to go to high school. She's a very social child. She cannot see spending the rest of her high school years as stuck at home with her mom. And if we don't have the intersectional social response for our young people, then we're not going to maintain the engagement we need in the need for the long game, the long protest, the long strategy around changing policy and changing culture and changing hearts and minds.
Yeah, we can't risk losing the sense of community. One of the things I wanted to raise, because kind of how I look at the world, there's been a number of studies that suggest that if we could eliminate racial segregation, that would eliminate all disparities in Black-white health outcomes just by getting rid of segregation. And as you know, we're more segregated now than we were 50 years ago. So talk a little bit about how the movement fits in there, because we're hearing a lot, but I've not yet heard people sort of take on this issue of segregation, desegregation, and what that meant and what it means now.
Well, I think the whole country between now and the 19th of June is about to learn about the difference between segregation, desegregation, integration, and assimilation, right? Mm-hmm. And that you will have plenty of people who will argue that desegregation without equity and justice did not solve our problem. And integration without equity and justice and anti-Black racism did not solve our problem either. So I think that the fact that we are starkly segregated in certain ways, that the same way pre-desegregation allowed for the Black Wall Streets of Tulsa to exist, for the Rosewoods and the Jacksonville, Floridas to exist, for the Forsyth counties of Georgia to exist, where Black people were flourishing until white people got mad about how flourishing we were and destroyed it all with law behind them. That what we know is that desegregation is not going to fix it this time either. It will be the full-fledged opportunity to engage fully with equity and with justice and with power, which means maybe segregation is required for a while, because the other end of it, and we were talking about all of these different voices that we're leaning into and listening to. I can't stop listening to Kimberly Jones talk about monopoly and the analogy with that, and the fact that she ends her commentary with, they should be glad that we're just looking for equality and not for revenge. And I think that that should be a t-shirt, and it should be up front, because that is the reality of anti-Black racism everywhere. Doesn't matter where you go in the world, that they're worried that we're going to do to them what they've done to us. And they only have 20-something years to kill us before we become the majority, during which time what we will be doing is seeking to equity for everybody. And that's what they don't understand, because they don't know how to give that.
So I was listening to something Kimberly said, and it brought back to mind a game that I think Psychology Today produced in the 70s. I was a kid, but it was called Blacks and Whites. And it started out where Black people got, I think, if I remember correctly, $10,000. White people started the game with $1 million. Black people couldn't buy on 3 sides of the board. So that started out with that. And I would love to find that game again, because I think it could be really instructive. So Marsha, you're in that.
Somebody's listening to you and they are already coding the digital version.
I hope so. Please, I will help. So you're in Dallas, where it's special. Yesterday, the president held a panel on policing, and most of the people who were on the panel were Black, but the top 3 law enforcement officers who are Black were not invited: the police chief, the sheriff, and the DA. So how do you have a conversation about policing without involving the law enforcement executives?
So I am in Dallas and I am in Texas, and that's always an interesting place to be. I say this all the time when I'm with folk. I'm in Texas. It just really makes it interesting being here. We don't have a really good history of Black women holding power without white women standing in the corner, like, we got you, we got her. So I find myself in an interesting position here in Dallas, because I'm very Black forward. I'm very unapologetically Black, and I don't let anybody push me any other way. And I also do this in a way whereby which I'm also able to bring on other folk who have been oppressed, who have to deal with these same oppressive systems, and not lose my Blackness. And so that's sometimes interesting. That's an interesting place I find myself in. But it's for them not to invite those people, because they did invite a police chief from a smaller area that I live about 15 minutes away from. They invited him, Glen Heights. So they did invite police lawmakers, but they handpicked. For all of the reasons, Chief Renee Hall should have been there. I find myself in a juxtaposition of a position right now, because the whole world wants to blame Chief Renee Hall for what happened on that bridge. And I have said openly, I will not stand and watch them railroad this Black woman out of a position that they've never wanted her to be in, when we don't hold the men standing around her to the same level of accountability, like our our city manager, as well as the white policeman, who I believe was invited, Mike Mata, who's the president of the police union, the white police union. And we know that Mike Mata have way more power than Renee Hall. So it's interesting that she wouldn't be there, also having a Black sheriff, and her not being there, and not having our Black DA there, who is fighting tooth and nail to end cash bail in this city. And you have other white district attorneys who's trying to sue him because he's saying that cash bail don't work. And we need to end cash bail. So I wouldn't have expected them to be there, because this is Dallas. And these kind of things seem to be acceptable. Like I say, there's this whole mirage of people who want to force this woman to resign. Resign why? Yes, what happened on that bridge was a catastrophe, but was it all her? No, it was not all her. And is it a conversation that we need to sit down and talk about? Yes, it is a conversation that we need to sit down and talk about. But most importantly, we need to support these two Black women who's sitting in a very powerful position in this city, because this has never been done. Our fire marshal is a Black man. Our district attorney is a Black man. Our sheriff is a Black woman. Our not our county commissioner, but our Dallas city secretary who runs this city is a Black man. This has never happened in Dallas before.
Right.
And somebody from that small circle should have been there. But that's acceptable in this city. They have meetings in this. They will have a conversation in this city about Black women and maternal mortality, and won't invite the Afiya Center. And they wasn't even talking about maternal mortality in this city until the Afiya Center started talking about it.
Right.
So if we get from somebody white, we may be invited, but we don't do it that way. We just bring ourselves to the table, whether we are invited to be at the table or not. We just come. And it's interesting. Like, I have to say this before I get off. It's interesting that I should sit here and listen to Dazon talk first, because forever, a minute in a day, I'm always on a meeting where Dazon is talking, and while she's talking, I'm writing, right? Because I need to know what to say when she get through. And so I've been listening to her so long now and doing my homework. I'm learning to hold it down without writing all her stuff.
You got the talking points, Dazon.
I have literally learned reproductive justice and how important that is in our lives, in the lives of Black people, listening to women like you, Dazon. I may be older, but that don't mean anything. Listening to you and being able to apply that conversation in every piece of the work that we do. Even our people who are on the streets now, getting people engaged in registered to vote, because that's what we're doing during this whole the revolution that's happening on the street. We are getting people registered to vote.
Okay, so you've sort of anticipated my question, my next one, which is, this is about power. I mean, as you saw, they tried to lay the blame at Renee Hall's feet. And for both of you, what do Black women need to do to ensure we're being heard, to claim our rightful place to be at those tables, and to be in, not just be in those conversations, but lead those conversations?
I think it's important. I think it's important for those of us who have managed to squeeze out a piece of power to be very vocal in that power and to always show up in that power. It was very powerful to be a Black-led organization and not have to lay off my staff, and to openly and to publicly say my staff will not be laid off, and to continue to lead this work. So I think that it's important that those coming behind us and those who are looking at us see that there is a power that we can have, and finding the place that we have the most power and utilizing that power in a very public way. We've got to talk about voting. We cannot run. This is a very complicated election yet again, but we can't run away from it. We have to find a way to mobilize around the better candidate that's running. It's complicated. We know it. We can't run from the things that's complicated to get to the things that's going to be better for us at the end.
We never do.
So I think publicly, that's what I would say. Black women who are walking in any power, walk in that power publicly, walk in that power loudly, walk in that power with much assurance that you can hold this and you can handle this, because we got the world standing behind us right now. This is the best opportunity in the world for Black women to show up.
Yeah.
Unapologetically showing up. You were talking, Marsha, it just reminded me, Linda, and you'll remember this too, that after the 2016 election and the next day, and we learned, that the majority of white women in this country voted for a rapist and a known crook to lead this country to where we are now, that it didn't take long in the RJ space for Black women to see immediately in numbers what our value is in terms of our power as a collective force in the voting booth, right? And that if we continue to garner that and build that and lift that up, right? And here we are, where now all Black people see the same thing. Because if y'all remember, in a couple of weeks after that, it didn't matter where we were. When a white girl got up on the stage and tried to Black-splain the election and what happened with this president we have, we were like, no, have a seat and have many seats and sit down for a while until we tell you to come back up that corner, because you have no more juice with us, and you obviously don't have any more juice in the ballot box, and you don't have juice with your own people. So if we could learn as a collective force of Black folks and people of color that are not Black, that the power is, you can see the number. Yes. And that you can stand up and tell them to have a seat. Mm-hmm. And if they don't, just take the seat away. And that's what's happening when you see we have so many leaders in Dallas that look like us, and so many leaders in Atlanta that, as Dulce Sloan would say, I come from Atlanta where we make Black people. So, we know that we have it. It is about being organized. It's about planning. It's about already knowing how you're going to respond, because you know how they're going to react. Yes. And so it's already being in front of that and not being reacting to the pain all the time, but to bring the pain. And I don't mean in the physical way where we have to put our knees on people's necks and kill them, but we can hurt them in the pocket. We can hurt them at the ballot. We can hurt them in the workplace. We can hurt them in a whole lot of ways that we have not asserted collectively, that I think now is the time to talk about and to take action on. We have to think in the future, act in the now.
Wow. So Marsha, I wanted to ask you about your article in Essence. Mm-hmm. You talk about the fact that, many Black women, we're classified as essential workers, and were so during COVID-19. And, then there were so many of us that were laid off. But what that did was, for these essential workers, is it put us oftentimes face to face with an unmasked and angry public. Yeah. Sometimes, so, while that was good enough, have them go back to work, put yourself in harm's way. At the same time, they're denied rights to reproductive health services like contraception care, abortion care. You started something called the CIS Fund. So yes. Can you talk a little bit about that and what it is and how women can get assistance?
So a couple of things happened at the same time. COVID happened. We shut down the city. People couldn't work. We had essential workers. But at the same time, the bill that was passed here in Dallas for paid time off and was repealed. So they repealed, like they're fighting to change that, to overturn their law, right? So at a time where people need to be paid to be off at the most, you take that away. And then we're still fighting for people to get paid a living wage here. And that's still a fight in Texas. So those were the things that happened. But I had just had a conversation with my staff and my team, because we're not a staff, we're a team. I just had a conversation with my team, and I said, y'all, we know that abortions are going to kick up for us, right? It's going to kick up. Folk are in a situation where they can't get out, and they're going to have sex where they cannot negotiate it. And so abortions are going to kick up, and we're going to have to be there. And so we were already word of mouth. So people knew that the Afiya Center would pay for you, whatever was going on, we would do our best. And so that's exactly what happened. People started calling us. And so before the person who runs our fund could get them in, it was like they couldn't get in. Only medical emergencies could happen. And then abortion was an essential thing. And I was like, no, y'all, we can't do this. This cannot happen, because for these women who need abortions, for us, the situation is larger than what you're looking at. These women are the women who are out here working every day. We cannot force them into more poverty. We're going to force them to have a child. They cannot even afford the children that they have now. We're going to force them to stay in abusive relationships. We're going to force all these things upon him. You're in a state that won't even give people Medicaid and Medicare. So now we're forcing them to now still be able to not take care of themselves. You're in a state where they're more likely to die from childbirth, and their child is more likely to die. And you're going to force this on them? No, we can't do this. And so we kicked up CIS. And so CIS is Sisters supporting your sisters. That's what it is. And so we do just a little bit outside of a regular support fund where like they'll pay, we call ours compassionate practical support, not just practical support, because we take care of babysitting bills. We get them a hotel to stay in if they have to. We not only give them the money to get there, we feed them and we keep them in our system for 13 months. We don't let them go like right after the abortion happened. We keep them there. If they keep calling abortion funds and they can't get any help at the Afiya Center, all they have to do is call us back 2 times. If they've already called an abortion fund and nobody has called them back, because I know historically what happens in a Black family. You get to talking to church folk too much. You get to talking to folk in your family who's telling you how Susie had her babies and she kept, or whatever Susie did. You know, before you know it, guilt sit in and you'll keep that baby. You'll go full time with that pregnancy. And so I've said to them, Black girls only call us 2 times. After that, we're going to find the money to pay for this whole procedure if we have to. And so that's what happened. And so we were actually had to find monies to help one young sister get to New Mexico. She needed her job. She could not be carrying her baby full term. She did not have money to do what she was doing. And it was important. And so that was just that important to us. And it became even more important during this time of COVID. And we're still helping essential workers at the Afiya Center.
All right. Thank you. So we've got 1 minute left. Dazon, I'm going to give you the last question. And there's so much. What do you want Black women to do between now and November 3rd? We know what we want them to do on the 3rd, but what do you want Black women to do between now and November 3rd?
I want Black women to learn.
Wow.
I want Black women to learn about who's running and what they're running for in their local elections, in their state elections. Don't wait until the day before to start looking who's going to be on the ballot in November. You should already know what's happening from the primaries until then. In addition to that, I want them to share what they learn, whether it's on their social media spaces in a way that's not just going to be a clickbait kind of thing or just roll through, but have real conversations with people, not just the back and forth, one sentence. I know how Twitter works, but that needs to be a conversation, not just a outputting message or a push message. I also want Black women to take care of ourselves. I just changed the name of a workshop that we do that we usually call it Meet 3 Ginas. It's a long thing about the intersections of HIV and cervical cancer in Black women and 3 women named Gina Brown. But I decided, what, there's not just 3 women named Gina Brown. There's all kinds of women. And we walk, Black women walk with that one beautiful mantra about how, everybody thinks that we're 20 years younger than we are. Everybody. There's no way you're 55. You don't look a day over 39. And then we always go, Black don't crack. My answer is only on the inside. Yeah. So I know that we have to recognize that we look good while we're walking wounded, walking damn near dead, walking sick. We are cracking the hell up inside. And if we're not taking care of ourselves, then nothing will happen because we have to be the strongest for this fight. African women gave birth. Here's my lasting thing that I think every Black woman should know, embrace, and live to. And that is, it is the African woman who gave birth to this planet of humanity, and it will be us who save our children. Mm-hmm. It will be the African women, planet-wide, worldwide, who save this planet, but not if we can't save ourselves first.
All right. Dazon Dixon Diallo, founder and president of Sister Love, Marsha Jones, co-founder and executive director of the Afiya Center. Thank you very much. Be strong, my sisters.
Thank you. Thank you, Linda, BWHI. Y'all stay strong for all the rest of us.
Thank you. So now let's bring on Jemea Dorsey, Chief Executive Officer for the Center for Black Women's Wellness. Jemea Center provides wellness and I would say, Jemea, you are very much on the front lines in all of this. So I want to start with you with talking about prenatal care. We've heard that many stories of Black women in particular putting off prenatal care or their well woman visits even because they're afraid of COVID-19, of contracting it in healthcare settings. Have you seen that? And how has the center been impacted?
Mm-hmm. Well, first and foremost, I just want to say, Dazon, as always, I'm always energized and motivated hearing her and Marsha, who I don't think I've had the chance to meet before, but I just want to thank them for their remarks that are right on time. And Linda, I want to thank you for this opportunity. And I want everyone to know that the Center for Black Women's Wellness, while we're a local community-based organization in Atlanta, our histories are tied, and that it was the Black Women's Health Imperative way back in 1988 that birthed the Center for Black Women's Wellness. And so we were birthed from that movement. And while both organizations have evolved and progress and move forward, that is something that we hold near and dear to our hearts. And Linda, I need you to know that everybody who comes and encounters and works at the Center for Black Women's Wellness understands that history and knows that we are a part of something extremely special. I just want to say that. And when I think about what's going on now, and especially, of course, we're dealing with, front and center are two pandemics, COVID and racism. Of course, racism is not new, but now it's front and center. And there's a lot that we need to capture in this moment and continue to move so many things forward, as the other guests just talked about. So we, being in a city-owned building, we are still, Mayor Keisha, she does not play. Black and brown folks, we know we have been disproportionately impacted by COVID. And so she has very astutely been very much more methodical about opening up the city. And so while our governor, of course, unleashed the doors wide open in late April, our city-owned building has been closed since mid-March. So that's allowed us to pivot and actually do roll out telehealth to make sure that we are still taking care of the needs of women in terms of certainly chronic disease management, so that we're able to help with the management of underlying conditions, which we know certainly makes you more at risk for COVID mortality. But we also are providing a lot of education, because that is essential, that in addition to the provision of healthcare, it's really about that education and self-advocacy that is paramount, especially when we're talking about our pregnant and postpartum women. We provide prenatal home visiting to around 450 pregnant and postpartum women annually. And as part of that model, going into the homes of women, that now has to be done virtually. That social connection, that interaction is still so important, because again, while we are all about it, of course, we have the social distance and physical distance, we understand we need each other. And we need, just as Dazon was talking about, educating and harnessing this power that we have that's been muffled for too long, that, by continuing to be in the lives of women, especially, vulnerable, very vulnerable women, we are basically saying it's time for us to continue to lift up our voices, to continue to understand that there are things that we could be doing now. There are things that we do hold back on, like we have not been able to do Pap tests in the past 3 months. We're very eager, hopefully in June, to begin doing that again, because obviously you cannot do some of that critical women's healthcare virtually. We are going to be doing our next mobile mammography unit in mid-June, so we're excited about that, because at the end of the day, there's work that we all have to do to take charge of our health, but through education and through the provision of accessible healthcare. But then in addition to that, and the things that I think that we're really talking about are, what are the policies and what's the systems change that needs to happen? Because all these personal changes and things that we know it's important to do, if the systems don't change, the health inequities continue to exist.
Sure.
And so that is something that we're working on just as rigorously as we are in the provision of needed health care.
So you had to offer your services urgently, and telemedicine is not a replacement for in-person medicine. However, not all medical care needs to be delivered in person. So as you kind of think about where we are now, there will be another wave. Likely, I'm not even sure we're even out of the first wave, honestly,
Right.
Of COVID-19. You know, what do you see as sort of the future? And I'll just tell you, I've talked to a few physicians who say, in fact, telemedicine could be helpful because then we can see what's actually happening in the home, and it may actually help reduce the bias, the stigma, the judgmental nature of medicine, the racism, because they see or could see actually how people live. But what does the future look like in terms of telemedicine for you?
Well, that's interesting that you say you can see how people live, but it depends on who's looking and what are they looking for, right? So if you're looking with the lens of it doesn't matter how your home looks, that there's no judgment in that, then yes, I think that from that standpoint, it is critically powerful. And it's, as you just said, it's not an either or, it's a both and. And that's what we have learned as an organization, that in our strategic plan, we were not even envisioning doing telehealth until the end of 2021. And of course, with COVID, everybody had to pivot and accelerate plans. And so this ended up being a great opportunity for us to then say, okay, well, what does that look like? And so we are a workforce of, we've got paid healthcare providers and also volunteers. And so this actually provides an opportunity for everybody to, of course, it removes barriers to transportation. You're doing it in the comfort of your home. You're not having to arrange childcare in many instances. So it's reducing a lot of those barriers that traditionally exist. And at the same time, that in-person care is also important. So it's a both and. And what I think that moving for the future for us, it really means being able to see more patients and allowing more women to come in who actually need to be seen in person. And for those that can be done through telehealth, doing it that way so that you're actually expanding access to care for all.
Well, thank you. Jemea Dorsey, Chief Executive Officer for the Center for Black Women's Wellness. Keep up the work. We appreciate what you're doing. And as a part of Black Women's Health Imperative, you're always in the family. I'm so proud of you. Thank you.
Oh, thank you. Thank you for having me.
Take care.
All right.
Our last guest is Dr. Quinn Gentry, affectionately known as Dr. Quinn. She's president and CEO of Messages of Empowerment Productions. And Quinn and I've had the opportunity to work together on several occasions. And I'm just happy to have you here. It's great to see you.
Great to be here. Thank you for having me.
Absolutely. So, Quinn, you spent a fair amount of time talking and studying, writing about trauma and PTSD, especially related to sexual health and reproductive health. And I think about, I've got a son. So, he's an adult. I still worry about him. And a few years ago, I wrote an op-ed about PTSD in Black women resulting from watching videos of police violence. So how do you sort of marry epidemiology and statistics with what is happening on the ground day to day? And, how can, you are optimistic. How can mothers and sisters and partners stay motivated?
So one of the things that can keep people motivated in this time where we are right in the middle of the trauma, right, is to allow our stories to be front and center. Zora Neale Hurston said it best. She said, if you are silent about your pain, they will kill you and say you enjoyed it. And so one of the things that I've made sure that I am always checking to make sure that I don't get caught up in railroaded into shaping the narrative for all Black women around the narrative that we see in the media. So what I'm doing is I'm checking for the margins, right? What's happening on the margins that is not making its way to mainstream. And so there are a couple of things that are happening in terms of the trauma that we're experiencing that has to be spoken to right in the moment. We can't wait on epidemiological data to catch up in order for us to speak to real experiences. First of all, we need to send a shout out to Black mothers everywhere who are our real heroes. Because when Mama Keisha said, I don't care what your governor said, I said, stay in the house. What do? We stayed in the house. And I know in my own house, I have a millennia, and she was trying to get to a 21-year-old turn up. And I said, you know what? I'm going to empower you. You have choices. When you go, wherever you going, stay for 14 days. This is your choice. So I want to send a shout out to all the Black mothers who said, listen, I have been empowered with just a little bit of epidemiological data, enough to know that I will turn this house upside down to keep you safe in here and to make sure that you don't bring any disease back with what I'm already handling, meaning I have 4 generations right here in this household. Right? They were caring for a lot of people. And so that Black mama had to stand strong in her space to say, I got enough sense to make sure that you don't go out there and catch a disease that will take you out. So I will take you out in here before you go out there and it takes you out. But here's the thing, right when we had Black mothers getting a grasp on that, something that all of us learned, and everybody who knows me knows that I do not run from the fact that I am from the projects. And one of the things I learned in the projects is you don't hit nobody, but if somebody hits you, you hit them back. So we had locked down, we had gotten that under control, and then we heard that somebody hit one of our cousins, and what, he died. We was like, mama, mama, you said if somebody hit me, hit them back. And we broke loose and got outside. And we were like, you know what? There are some things, some fights you just have to go out and fight. You have to disrupt normal for people to know that you mean business. And so that, for the first time, what we did not do is we did not hit them with the ways in which we have always hit them, right? We went straight Audre Lorde on them. The master's tools will never dismantle the master's house. We got creatively confrontational. We got up in their faces in ways that they did not have a tactical response. And so I just want to say, I want to caution, our Black middle class in particular, in that we have to be careful in the ways that we tell children, go home. Don't you remember when we were complicit in tearing up their homes? Don't you remember when we stood idly by when they blew up their homes? We taught them how to blow up stuff and how to just take what you want. We walked in and blew up their schools. We blew up their community centers. We blew up the only church that would bring them in for vacation Bible school. And now we want them to have a different tactic when we watched them, when they watched us sit idly by, right? And blow up everything that they used to call, that they used to go to and congregate. So we have to own that. As a Black middle class, that we did some damage. We also have to own the fact that, first of all, I want to say that you didn't need me to wrap this up. That powerhouse, that trio you just had, I learned from all of them, right?
We always
I'm gonna say I echo that, and so in my conclusion, with the minutes that I have, I just want to say these are the things that we have to do in terms of empowerment. All of these are action words. The work that I do in advancing Black feminism in public health, I always end with these 10 points of power. If we don't know anything else as Black women, we know how to go to school and get an A. So now is the time to bring your A game. I need y'all to arise and accept full responsibility for that scholar activist you always claim that you are. We need you acting on every front. We need all of your intellect at the table, and we need all of your activism. You are not an either or, you are both. Let's go. I need you assessing differently. Again, bringing your lived experience to every piece of statistics that we see. And I need us analyzing different. Let me just say this. Fauci, I'm in public health. Dr. Birx, I'm in public health. And I want to say that I am appalled at the way in which you casually talked about my pain, as if it was to be expected. But that's, you know what? We are going to shift that. You will not just, in a matrix of domination kind of way, casually say, once you release the statistics that now COVID is now we have the highest burden, and casually say, but you expected it. No, I need you to say, I apologize for not bringing you what you needed for lupus. I apologize for not bringing you what you needed for HIV/AIDS. I apologize for not bringing you what you needed for heart disease. And now here you are having to bear the brunt of another disease because we did not get you what you needed. That's what I need from my top doctor in public health. So if you want to address it, we will. I need us to realize that even as educated as we are, there are still some things that we can do to assist, right? And our personal
in the next 2 minutes.
Okay, I got you.
Time.
Okay. And so if I have to wrap up in 2 minutes, then I'm going to go straight for the radical one. Act up, dismantle, disrupt, be creative in it. It is proverbial, yes. Just like the mayor of DC said, I got something for you. When you walk outside, come on your street, you're going to recognize what this movement is about. If you can mess up, the first revolution is in the head. And one of the things I am so proud of is every last one of us found our 10 to 12 white friends, our good friends, and said, come on now, you have got to get in this ring with us. So if we don't know anything else, we know how to align with the right people. We know how to be aggravating, but most of all, we know how to act up in ways that makes this intersectionality real for everybody, that you can't just come to us and talk about handling a single issue when our lives, we don't live single issue lives. So we have to fight on multiple fronts.
Right.
And I yield.
Amen. See, we brought the heat with you, Quinn, as we always do it. And I'll just say one thing you said made me think of a saying I've said many times. I mean, I am an epidemiologist, but before there was epidemiology, there was common sense.
That's right. That was a lived experience. That's right.
Quinn Gentry, President and CEO of Messages of Empowerment Productions. Thank you very much for bringing the heat.
Thank you.
Thank you. Take care.
Thank you. You too.
All right. So I want to thank all of our panelists today. Dazon Dixon Diallo, founder and president of Sister Love, Marsha Jones, co-founder and executive director of the Afiya Center, and Dr. Quinn Gentry, president and CEO of Messages of Empowerment Productions. I certainly enjoyed the panel, and they brought a lot of information, so I hope you all thought that was good as well. We have to act up. We've got to take care of ourselves. We've got to take control of our power. We've got to vote. So I want to thank you for joining us today. We have another episode planned for next Friday at 4 o'clock, where we'll talk about establishing relationships with allies and in the work toward racial and economic justice. And if you haven't already, please take a moment to visit our website, coronavirus.bwhi.org, which we've developed to provide information and other resources just for you. And I want to take a moment to thank you for being a part of these conversations for the past 2 months and for your support. BWHI has heard, and I've heard directly from Black women and white women and some men, their appreciation for the discussion of our issues, the expertise we brought to the table, and our willingness to have the very tough conversations. That support has been in the form of words and actions and donations. Thank you very much. You've encouraged us to keep going, and so we will. We're the only national organization fighting for Black women's emotional and physical and financial health. And I'm reaffirming to all of you our commitment to providing more information on what Black women can do to improve their health and wellness, more resources to help us prevent and manage the stress of COVID-19, more tools to fight the injustices we continue to experience that put us at higher risk for COVID-19 infections and death, and more resources to fight the many indignities we face, including having to use old shirts for our periods simply because we've lost our jobs. And I promise we'll continue to be at the table with federal and state lawmakers so that our voices are heard, our issues are made a priority to get legislation passed that serves us, our health, and our communities. We are in this fight with you and for you. Thank you, and we'll see you next week.